the oral presentation that I did at EHA is about the safety and some preliminary pharmacodynamic effects of the oral ferroportin inhibitor, Vamifeport, in patients with non-transfusion-dependent thalassemia. Now, before moving into this, I would really like to say what is a non-transfusion-dependent thalassemia. We all know that this is a group of patients that do not need or require continuous blood transfusion for survival. However, they might require it at a certain time or during a certain time in their life for growth, during surgery, pregnancy, or during if they have any complications. So it's important to highlight that this study is only on this group of patients, not the transfusion dependent, but the non-transfusion dependent. And what is important in this group, so that we will enter into the study, is that there is an imbalance between the alpha and beta ratio. This would lead to what we call ineffective erythropoiesis, anemia, and iron overload. So now, what is Vamifeport? It's HEPS. We need to understand what is it. To understand what is it, we need to understand that hepcidin is a peptide hormone that controls the iron level by binding into ferroportin. And this product also is the first oral small molecule drug that will bind to ferroportin in a similar way to hepcidin. And as a result, it will control the similar way to hepcidin. So the whole idea from this study is that iron restriction, when you restrict iron, you may limit iron overload and improve the ineffective erythropoiesis in this group of patients. And as a result, you will increase the red blood cell span. So the primary outcome of this study was to assess the safety and tolerability, as I said, and the secondary outcome is to assess the preliminary efficacy versus placebo. The whole study was done over 12 weeks. So before going further, for those of you who are interested, you could look into the details of the abstract, but it was very clear that the primary outcome was reached, and Vamifeport showed favorable safety and tolerability in this group of patients, whether received in a single dose or in a BID dose versus placebo. Also, in the secondary endpoint, there was a change from baseline in serum ferritin, iron, and the TSAT of those patients. So this study showed that Vamifeport is an effective ferroportin inhibitor that is safe and tolerable in NTDT patients, achieved primary endpoint in this 12 weeks, and also met the secondary endpoint by showing promising target engagement on serum iron and the TSAT. Further, it is evaluated, more data will come out, and it is evaluated more in sickle cell disease in another study also.